I really think by like listening to autistic folks, we could have so much better consent education. We could have so much better sexual education, so much better dating experiences, so much better everything, not to get too hyperbolic about it, but if we just listened to these folks rather than pretending that the world fits this very, very narrow little sliver of what it actually is.
Hello, everyone. This is Sex Positivity Unfiltered, where we talk about sex and we are not polite about it. My name is Lyndsey Murray.
And I'm Denise Stratton.
And for today's topic, we are discussing sex and autism. And here to dive into this subject with us is Ley David Elliette Cray, PhD, she, they. Ley David Elliette Cray, PhD, is an author, educator, coach, and consultant specializing in gender, sexuality, and relationship diversity within a neuro-inclusive framework. Beyond teaching philosophy at New Mexico State University, she is the founder of Transcendence Coaching, a queer centered, kink positive coaching practice, and has collaborated with groups including the Sexual Health Alliance, Charlie Health, Plura, Plume, Mon, Growth Through Change, Wild Geese Counseling Collective, the International Institute for Sexual Empowerment, Pragmatic Kinking, and more. Thank you so much for being here with us today. I feel like you have so much, not just professional knowledge, but personal knowledge as well. And this is a topic we've been wanting to dive into for a while. And what better person to be here with us today than you to talk about it with us?
Thank you so much for having me. I'm really excited to be here, and this is one of my favorite topics. So, yeah, let's get into it.
Perfect. So my first question for you is just how would you define autism? And I'm asking that because I feel like a lot of people don't really know what that is.
Yeah. So, this is a tricky one because I actually wouldn't try to define it.
Mm,
Because I think what we see with autism is we see this observable phenomenon that we've given a name to, and we're studying it and we're learning about it, and we're learning a lot about it rapidly, right? So, if we give a definition, it's going to be obsolete in 10 minutes, with the
mhm.
next paper published. So what I think we can do instead is like we can give like a characterization of it. And when I think of autism, there's this standard clinical characterization where it's like a neurodevelopmental disorder, all of that. I don't operate in that framework. And I think increasingly we're moving past that framework. So if I were to characterize autism, I would say it's a neurotype, which is it's a way of being cognitively, developmentally, experientially in the world, a natural variation of human experience. And it relates to differences from what is deemed normal in terms of communication style, sensory processing, information processing, um, let's see, interest and attention, et cetera, et cetera. There are a number of different factors, but basically, it's a very broad umbrella term to describe folks who deviate from what is considered the norm along those different aspects.
Yeah.
Okay, so what would be kind of like the signs? So I mean, being
Yeah.
queer, I definitely deviate from the norm, but how would I know if fell if I was part of the autism community just based
Yeah.
on you said sensory and communication?
Yeah, absolutely. So I'm glad you brought up queerness like this early in the convo because the analogies between queerness and autism are so striking, right? More generally, I should say the analogies between queerness and neurodiversity and neurodivergence are really striking. And then autism is like one way of being in that latter category. So what I would say is, there are the broad signs of that someone might be autistic. Like when I can tell that my friends are, and it's like, are you really, really interested in something to a degree where it almost excludes interest in lots of other things? You have this deep, like passionate knowledge um about like Super Mario Brothers or about potatoes or about autism, you know?
Yeah.
Um, there when I'm peer reviewing my friends for autism, I'll notice their physical mannerisms. Are there a lot of repetitive movements? Are they manipulating objects? Are they engaging their senses? How are they with eye contact? How are they in crowded rooms? Like if we're out at a bar and there's like not necessarily it being loud, but a lot of different sources of sound. Like how are they reacting? Right? All of those things we might think of are tips. They're little hints that someone might be autistic, but they don't guarantee it, right? And
Mhm.
you could be autistic without any of those. So my answer to that would be a lot like queerness. Like, how did I know I'm trans? Well, I learned about transness and I tried it on. And when I did, it just helped me navigate and interpret and understand the world so much better. Right? It was sort of a lens through which I understood myself. Now, the analogy there with autism isn't perfect, um, but there's some similarities there because, we're seeing this increase in self-diagnosis and sort of self-assessment with autism. And a lot of folks these days are seeing it as this kind of affirming lens, this interpretive lens to help them make sense of like the experiences they've had, the experiences they're having, helps them understand ways to project themselves into the future. So like very parallel with queerness.
So I have a lot of autistic clients.
Mhm,
So I am a therapist and I have a lot of autistic clients, but also working with couples where maybe like one partner is autistic and the other one isn't.
mhm,
And in my experience with these folks, like it's so different for every individual. There really is no like, hey, here's what guarantees it. One autistic person might have some kind of trait that another person doesn't. And I'm really big on allowing for self-diagnosis. Like I don't require an official evaluation. Because I think people know themselves pretty well. So if I have someone coming to me saying, I'm pretty sure I'm autistic and here's why, I believe them and we roll with that, which makes a lot of sense. That parallel to queerness, it's like, who am I to doubt that?
absolutely, absolutely. And I'm completely with you. People talk about the autism spectrum, but really it's a bunch of different spectra.
Mhm.
And the ways of being autistic are as varied as there are autistic people. And that's one of the reasons it's so hard to define it. Just like it's very hard to define queerness, except for by like pointing at what it's not.
Mm.
It's not the decided, determined norm, right? And with self-diagnosis in queerness, we used to diagnose people as homosexuals, and we learned we know better now. We don't diagnose people as queer.
Yeah.
Um, and my prediction, and I'll get canceled by some clinical folks for saying this, but my prediction is that in the relatively near future, we're not going to diagnose people with autism anymore because it's very similar to diagnosing people with homosexuality. Um, I think self ID is valid. And I would actually personally, and I'm speaking here as an autistic person, I would reject the characterization of autism as a disorder, because I don't think there's anything disordered about an autistic person. Just like there's nothing disordered with me for being trans or ace or any of the other identities I claim. That said, it still obviously can be disabling, right? I think a lot of times people run those terms together, thinking that like they almost use disability and disorder like interchangeably, but they're really not. Um, I think it's a natural way of being. It's a natural variation of human experience, but we've built up social structures and social conditions that are inaccessible for autistic folks, and as a result, those folks are disabled in those circumstances.
Yeah.
So I think we can understand a lot of the struggle of autistic folks under like a minority stress model, just like we do with a lot of the struggles of queerness. Again, there are differences, because there are some autistic folks who have very, very high support needs. And, folks who are, sort of nonverbal throughout their entire life, folks who really communicate differently than what we might call allistic folks, folks who aren't autistic. But there, it's not that they're like defective. It's just they are a very particular natural variation of human experience that society is not at all designed to accommodate.
I really love that take
Yeah.
because in like so even going back, I mean, I was in grad school like 2014, 2015. So even I guess like over the past, 9, 10 years, um, the approach to like having autistic clients or interacting with autistic people has changed a lot even in the past 9, 10 years because it was very pathologizing. It still is. But I feel like a lot of my therapy friends, like at my age, were trying to change the narrative maybe and come at it from there's nothing to really like fix about you. It's just we're trying to help you understand yourself better. How do you express your needs? If you had like an autistic meltdown, like what's the need that wasn't being met, as opposed to you've suddenly got to change all your behavior because that's really it's impossible, right?
Yeah. Yeah, and it starts to turn into that changing behavior, like sort of mandatory masking for autistic folks,
Yeah.
is essentially an attempt to behaviorally change autistic folks into allistic neurotypical folks, which, again, by analogy with queerness, we might see as akin to conversion therapy. Um, it's taking someone and making them other than they are. It's converting them from autistic to allistic. And what we've seen throughout history is that can do great violence, great harm to autistic folks. Masking, like the way I understand masking, um, and I get this from psychologist and autism advocate, neurodiversity advocate Nick Walker. In her collection Neuroqueer Heresies, she talks about, masking as basically this performance of neurotypicality in a situation where you kind of push down or ignore your own particular needs or sort of more comfortable way of behaving in order to basically accommodate the dominant expectations around you.
Hmm.
And Walker then gives this analysis of neurotypicality as like it's not its own special, it's not like a neurotypical isn't a way that your brain is. It isn't like a neurotype. It's just in a society, being able to mask and pass as like not neurodivergent without it being disabling. Um, so you get this way of thinking of like neurodivergence as you're neurodivergent to the extent that masking is disabling to you.
Yeah. Denise, I'm asking you, Denise, because I know I'm coming from like my therapy hat, but I want to hear from you as like a non-therapist person. Have you heard of masking before?
Never. I didn't know it. I actually still don't really know what that is.
Yeah, so masking, like everything you're saying is spot on and accurate. A lot of autistic people, especially if um they've been undiagnosed for a while. Like I have a lot of clients that will come to me at 45 years old and are just now realizing, "Oh, I'm autistic," and have
Yeah.
been my whole life. Didn't know, I didn't have the language for that. And masking can be very like, if I'm looking across the room, I can kind of gauge what is expected of me. Like, what's the appropriate, quote unquote, appropriate behavior here? I'll morph into that. But then I'm
Mhm.
probably going to walk away feeling that wasn't authentic to me. I'm not allowed to be myself around these people because I'll be looked down upon. Um, and it's
This
very
this
exhausting.
is probably a really bad analogy to compare, but that just gave me so kind of like Dexter, like the show Dexter, where he just kind of tried to move through the motions and figure out kind of what was normal, just so like they wouldn't see him behind his mask. Yeah, yeah, it's about the
Yeah,
same.
the way that he's kind of having to really observe the social norms around him and then act in accordance with them, even though that's not coming natural to him. And,
Mhm.
there's the strain that that puts on you. I think
Yeah,
another way of understanding it is by analogy with code switching.
yeah, same.
Mhm.
Yeah,
So like as a trans person who looks and sounds the way that I do, I can still pass as male in a lot of contexts, and there are some contexts like where I will lean into that for safety, because, I want to be able to pee in a Texas restroom when I'm in an airport, without being
Mm.
harassed. So I go in lazy mode, which some people would call boy mode, right? And there I'm consciously like mindful of how I'm presenting, how I'm taking up space, how I'm like, presenting myself. And it's exhausting. But it's a way of minimizing threat, and I think masking is a very similar thing. One difference being that when I do that, I'm doing that consciously. When I do the like lazy mode thing,
Mhm.
um, I think for a lot of autistic folks, and Lindsay, maybe you'll agree with this too from your
Mhm.
experience, a lot of a lot of them, especially if they're not um, diagnosed or understanding themselves as autistic,
Mhm.
they might not know that they're masking. I
Mm.
think we can definitely just pick it up by habit and think that we have all of these tendencies that are wrong that we try to suppress. And it's exhausting to us because we've internalized this almost this internalized ableism that tells us that we're broken or defective and we just need to be normal. And once we get language like masking, that can really recontextualize that stuff and lead to some frustration, some disappointment, but also like a big sigh of relief.
I would agree with you. That's the experience that most of my clients have.
Yeah.
They're not it's not an active choice really. It's more like they reach a point where masking is no longer sustainable. Like they reach a point of I just can't do this anymore. It's so exhausting. And now that I realize what I'm doing, oh, and now I realize I probably am autistic. It all kind of unfolds. And like, especially when I'm working with couples, let's say, and one partner's realizing about themselves, you're exactly right. It's simultaneously, it's a sigh of relief, but it's also like, well, now what? Like, how do I lean into who I really am? And what does that even mean for like, do I even know who I like truly am? So then it's like this sort of this journey almost.
Yeah, this is actually so my mind has been blown a couple times just in these like 10 minutes that we've been talking. I definitely see the parallels to the queer community. Like that's insane the amount of parallels that I'm seeing. But the one difference that I do see, and you brought up time, it might be the fact that it's just our generation right now, is the fact that whenever someone says the word autism to me, I do just automatically go into that medical, psychological, like this is a professional diagnosis that should be put on you. Like, okay, I'm going to give an example of my mother is one of those people who is self-diagnosing, who learned what autism is, and she's like, that might be me. When hearing that from my mother, who I've known for, all my life, I was like, oh, well, you probably need to go to a professional to make sure that this is what you are. But from what I'm hearing is it might be a self-diagnosis. It might not be something that requires um professional help. It might just be something that like being queer, something that you just are, right? So my next question, especially to my two experts here, since I have you, is I guess how does autism impact relationships and intimacy? Let me just ask that
Oh, yeah.
question.
Yeah. So I think it can affect in a lot of ways,
Okay.
right? And, you know, sometimes people can be hesitant to disclose in a relationship that they're autistic. So, like on my little Tinder profile, I go back and forth about whether I want to put it on there. Uh,
Mm,
because there's a lot of misconception about autism out there. And that's not the fault of the people who have the conception, but it's our dominant cultural narrative. So the way autism is shown, like in the media and commonly discussed, is this sort of very, very high support needs,
Mm-hmm.
very narrow focus on that, almost always focused on adolescent males, adolescent cisgender males. The joke is that boys are diagnosed with autism, girls are diagnosed with borderline personality disorder. A lot to say there about all of that. But it has tended to be a very gendered diagnosis. Um, and it's also a very recent diagnosis. Like autism has not been around for that long as like like clinical or sort of experiential concept. It's relatively new, so we're still really unpacking it, and it had such a narrow focus for so long. And I think what we're appreciating now, um, and what younger folks are leaning into, is how broad it can be. And this idea that, like, there's this sort of paradigm notion of autism that gets pushed in the media. But if we think that that is what is autism, that's like thinking that queerness is like Will from Will and Grace.
Got it.
Uh, it's like so much bigger than that. I do put it these days in my Tinder profile though, because autistic dating and autistic intimacy, in my experience and in the experience of so many folks I work with, is so different. Uh, so different.
Mm.
Um, let's say you're on a first date with someone and they're sharing a story about their life, right? One of my urges is to show them that I relate to their story and that I understand their story by telling them a similar story about myself,
Yeah.
right?
Yeah.
Yeah.
But a lot of folks see that as very rude. It's like, "Oh, you didn't ask me questions. Oh, you took the talking stick. We were talking about me, and then you made it about you." But for a
Okay.
lot of autistic folks, like, that's a way of connecting. It's a way of showing, "I understood you." But that's a big difference in communication. Not to say that one is better than the other, you know? Um, Same thing thinking about, eye contact. So when I'm in a public setting, my eyes are darting around a lot. I look around at a lot of different things because when there's movement, I just go to it. And that in a neurotypical dating context can be seen as kind of like, oh, I'm not paying attention. I'm not invested in the person, or else I'd be making sustained eye contact. And then when I do make eye contact, it's very intense. And then it freaks people out because it's like, no, you're not in the sweet spot of eye contact that is deemed acceptable. You're either too little or too much. And I'm just like, next, I don't want to be on this date anymore. And when we look at flirting, so much of flirting in neurotypical context is based on suggestion and subtext. It's based on like what isn't said. And for a lot of autistic folks, that if it isn't said, it's not said. Like I'm very bad at detecting flirting. I can't do it. I don't know how to do it. I prefer to be sort of open and upfront. And this same sort of thing, you mentioned context of intimacy too. It shows up when we're talking about intimate encounters, erotic encounters, sexual encounters, where in a lot of neurotypical versions of those things, things are left unsaid, things are left unspoken. It's almost like you're supposed to know. And that can create an environment that can be really uncomfortable for a lot of autistic folks who like need that explicit verbal confirmation or even negotiation, to borrow a term from the BDSM community, to help navigate.
Well, and it can also be unsafe if we're relying on like the unsaid, the gray area. Um, People have had traumatic experiences with things not being said, and and I do have like an observation. Maybe you could speak more to this, but thinking about like my couples therapy experience, the unsaid and like the lack of directness comes up a lot when we're talking about emotion and emotional needs. I see it quite often where neurotypical partner will say, "Well, my emotional needs aren't being met." But autistic partner will think, "I thought I'd been showing you I care about you and you're not seeing it." But then the neurotypical partner isn't explicit. They're not saying, "Hey, here's what I need from you when I express this." They're just kind of saying a bunch of stuff, but there's no real meat to the conversation, if that makes any sense. Like I see that where, it isn't all just on the autistic person to shape to this other way. I kind of see it goes both ways, right? Like how could we communicate more clearly?
Absolutely. I wrote a blog post for the Sexual Health Alliance's Nymphomedia blog maybe a year ago now, dating tips for dating neurodivergent. So it wasn't tips for neurodivergent people who are dating, but it was tips for when your partner is neurodivergent. And I definitely talked about that because yeah, you can't expect if you're gonna date an autistic person for them to just accommodate your allistic self.
Mm.
Um, that would be to basically prescribe them to mask in order to be in a relationship with you. So you need to meet them in the middle. Not to say that like, you I can't go in a relationship and play the autism card and be like, okay, so I control everything, right?
Yeah.
We collaborate. We build structures that are accessible for both of us. And that's in the context of autistic and non-autistic dating. But also, I think it all applies to dating within the autistic community too. Because as we said earlier, no two autistic people experience autism the same. And
Mhm.
I definitely have autistic acquaintances who I personally really have a hard time being around because our needs when we're unmasked are grossly incompatible. Uh,
Mhm.
and we realize it's nothing personal. It's just you stim by whistling, and whistling absolutely triggers my, like, sensory processing, like, misery, and we can't both be grounded at the same time. So, you're lovely, but this ain't gonna work.
Yeah.
That's fair. That's fair. So I wanna kind of shift back a little bit because I want to know how you came to discover this portion of yourself, like in your life's journey. How did you discover that you were part of the autistic community?
Yeah, that's a great question. I'm happy to talk about it because 'cause I'm also a Leo, so I love, like, talking about myself. Um, I'm like the most Leo you've ever met of any so in my progression of identities, like I guess someone could accuse me of being one of those people who like collects all the little subgenres of identity, but really it's just like I'm autistic, so I'm very, very attuned to self-understanding. I'm very interested in accurately describing my experiences. So going for what people call labels, I prefer to call them lenses. Like it's a really, really a benefit for me. And my progression was non-monogamous first, and that was like almost 2 decades ago, that I first started identifying in that way. And then I got on the trans pipeline. So I went he, him to he, they to they, them to they, she to she, they, then to she, her, and then back to she, they. So, I had that whole detour through non-binary into trans woman and now somewhere in between the two. Oh yeah, before trans, I started identifying as kinky. Um, so non-monogamous, then kinky, then trans, then asexual, then aromantic, and then I was like, okay, I need to take a look at this. And I had been doing a lot of reading about autism. I had been doing a lot of work on autism. And it more than ever was really just kind of feeling like it fit. And it felt like it fit in the same way that transness and asexuality and these things fit. And I realized that what was keeping me from like exploring it further was this worry about imposter syndrome. Right.
Mm.
So I knew I was trans 7 years before I accepted it, but I couldn't let myself accept it because I was worried that I was just another, like, cis white guy appropriating queer spaces, and I didn't wanna do that. I felt like it wasn't for me. Um, and eventually I got over that, and then same thing with like being asexual. I was like, well, I'm not really that. And if I call myself that, people aren't going to want to be around me. They're not going to want to date me. So there's a lot of stigma to exploring some of these identities. But I started looking up a bunch of autism assessments and sort of going through them, like the sort of stuff that, Lindsay, you might give to your clients if you were doing an assessment.
Mhm.
Started going through a bunch of different ones, and I was getting very consistent results. Now someone might say that I was skewing it in that I was, like, looking for a diagnosis, so I was, like, answering questions so I would get what I was secretly looking for, because if I didn't think I was autistic, I wouldn't be taking those assessments.
Yeah.
But eventually I was like, "Okay, yeah, this is an identity that I live, that I experience, that makes sense of me to me." And since then, it's just been such a boon and benefit to me personally and socially. Like, all my friends are queer, all my friends are autistic, and that's not an accident because autistic folks are more likely to be queer and queer folks are more likely to be autistic. And
Mhm.
also, you find your people. Um, People talk about this myth of social contagion where it's like, oh, my kid went to school and they came back trans, or my kid went to school and they came back and now they think they're autistic because all their friends are. And it's like, well, honey, when we're pushed to the margins, of course people are going to hang out with people who are like them. It's not social contagion. It's just like
Yeah.
finding like, like this isn't puzzling. But yeah, so that's kind of a long answer to your question. It was a long journey. It was one step in a series of self explorations. There was resistance to it due to the social stigma and due to feeling like I was contributing to some kind of problem if I took that label for myself. But when I gave myself permission to, things started falling into place. And now I don't think there's a single person I know who doesn't think I'm autistic.
I Thanks for sharing that. That's so we're here to hear about you all day, by the way.
Yeah,
So
yeah.
we're like any story, I'm like, I want to hear it. That is such a great point about like the social contagion because I mean, like Denise and I are friends, and like, you've known my husband longer than I've known
Oh,
him,
yeah.
so we're all kind of like in this big group. And it is so funny to talk about because like a lot of our group is queer. Like I have ADHD, and then I went and got diagnosed with ADHD, and not comparing that to autism, but when I got the diagnosis, like half of my friend group was like, "Oh yeah, I have ADHD too, and I take Adderall." And I was like, "Oh, this is why we get along so well because we're like on the same, like it's the same wavelength, you know." So you do kind of gravitate towards.
People like you, birds of a feather
Oh,
flock together. Yeah, for real. It's
exactly.
it's crazy. I have that same example where in my high school, all of us who sat in the same lunch table, really good close group of friends who were all straight in high school. As soon as we all went to college or grew up or everything, everyone came out. None of us even mentioned, like there would be no hint of even mentioning the word gay in my high school table cafeteria.
Mhm.
But since then, yeah, now we're all out and proud and living our best lives. So yeah, birds of a feather for sure.
Absolutely.
Were you an adult whenever you discovered this? Yeah, yeah.
Yeah,
Okay.
yeah, and that was another hurdle for me. And it's one of the reasons that one of the reasons, not the only reason, but one of the reasons that I haven't pursued getting a formal diagnosis, right?
Okay.
Because even though I think personally in terms of best practice, we shouldn't diagnose because it perpetuates this medical pathological framework, right? So I think just like we shouldn't diagnose queerness, we shouldn't diagnose autism, um, which is a little bit of a radical view, but there's still benefits to getting it because then in principle you can petition for access to accommodations more easily than if you're self ID'd. Because employers they often want paperwork if they're gonna like cut you any like slack, as it were, offer you appropriate accommodations, right?
Yeah.
So I've thought about getting it, but getting an autism diagnosis as an adult is pretty tricky, because there's still a lot of clinicians who think like, no, this is since this is a adolescent thing. If you don't get the diagnosis early in life, you're just never gonna get it. And that's a myth. It's nonsense. But yeah, it definitely came to me later in life. And I'm glad it did.
Okay.
Yeah.
Mhm.
So there is, much like with queerness, this hypothetical that you can get lost in sometime where, sometimes I think like, what would my life be like if I had realized that I was trans like much, much earlier, or if I had come out when I first kind of knew it in my gut.
Yep.
Or what if I had realized that I was ace back when I was having my, like, initial sexual awakening and had that language and that understanding so that I didn't accumulate a lot of the experiences that I had that went on to be experiences I didn't wanna have, you know? Um, and I wonder that sometimes with autism. It's like, if I as a kid had been identified as autistic, like, how would my life have been different? What sort of possibilities would have been opened up to me? But when I think about it, I kind of settle on this feeling that I'm glad I wasn't identified as a kid, just because of the way my autism manifests and the way it's treated. I think I would have been pushed into a medical pipeline or my parents made a very they made a point of keeping me out of the gifted program when I was a kid, and I'm really glad they did, because like we know the trauma that can come with that sort of that
Mm.
pipeline that puts you on.
Yeah.
So in terms of like how things actually developed, I'm glad that I really like came to it later in life because I was able to have the set of experiences that I actually had that now I can look back on. Whereas if I had this lens earlier, I might not have had that set of experiences. If that makes sense.
Yeah,
It
yeah.
does. Yeah.
Although I will say I can definitely see the benefits of identifying someone, especially in adolescence. I can see the benefits of identifying someone part of the autistic spectrum just for um the outside society being able to understand, how to communicate and how to approach someone. I love the terms that you were saying, how it's a different level of support needs, right? And so you do have support needs that are on the more extreme. And when I think of that, I'm thinking nonverbal, cannot be touched, cannot, kind of what you see in the media, I guess.
I
Um,
And I think there's also like pros and cons when it comes to um if you're young getting diagnosed or even like disclosing to an employer. If you It's kind of like and I've had clients ask me this, like, should I tell my job? Should I ask for this? It really, I hate to say it, but it's true. It really like depends on the job. Like you might work for an employer that as soon as you disclose, they might treat you differently. Even though that's illegal, it doesn't really stop employers from doing that. And then, but if you work for like a really great employer, you might get like the access that you've been needing. I mean, it's such a I know for people I've talked to, that's such a hard decision to know, is this going to help me or is it going to like have a negative impact on me to
Yeah,
disclose that?
absolutely. Absolutely. And I'm thinking now of the connections between like a formal diagnosis and also the sort of barriers that people need to go through, like trans folks need to go through in order to get gender affirming care. Right? Like,
Mhm.
I don't need a diagnosis of gender dysphoria to tell me that I experience gender dysphoria. But
Mm.
in order to get something like bottom surgery, I'm gonna need that. Um, and of course, there are services out there that understand informed consent, and I can pay them to write a letter for me. But then there are other folks that are like very by the book, and they're like, no, you have to do this, and then you have to do that. So there's this kind of we live in a very gatekeepy scenario with respect to
Mm.
all of these
Mhm.
experiences, and we got to navigate that realistically. I think while also working in tandem to erode the gates. And that's something that we can all chip in on. That's where like allyship comes in. Because like one of the best accommodations that autistic folk need is like allistic folk to like listen to them and then help.
Mm.
Really take it seriously and like and listen to them. Not help the way they think they need to help, but like help. And when I say listen there, right, I want to connect that too to the nonverbal folks. Because nonverbal autistic folks, it doesn't mean they don't have an inner life. It doesn't mean they don't have like a complicated, nuanced experience of the world. Like there's this tendency to see like very high support need folks as like less human, right?
Mhm.
But if we think of it as they're a very different way of being human, and different there just means in terms of having some differences. It's not a judgmental concept or anything like that. And there is a way to learn to listen to nonverbal folks to as they express their needs. It's a matter of translation. It's a matter of learning kind of an expanded language. And if we commit to that, like we can do it. Yeah.
Yeah, absolutely.
I love that actually. That's
I know. It's such a
translation.
great, I mean, that's such a beautiful, it's like, it's so nuanced. And I think you said it very well of what holistic people can do. I am curious. I mean, I'm going back a little bit to um masking and even like your own personal experience, kind of bringing sex into this. One of the questions I had was like, if an autistic person has an overall experience of masking during sex and then they are learning that's not how I actually want to show up in a sexual context. I want to unmask now. I want to explore that. If you could speak more to that, because I think that's a very common experience. And I also think it can be traumatizing to look back and realize, oh, I've done a lot of stuff that
Mhm.
maybe I didn't really want to do.
Yeah, absolutely. Like that trauma point is, I think, so powerful and so central and also so difficult to look at for
Mhm.
people who experience it because, when we get these new lenses for understanding ourselves and then we look back and we're able to recontextualize and sort of understand our like underlying motivations and pressures we might have felt, it can really unsettle, you know?
Mhm.
But yeah, sex and autism and unmasking, it's a fascinating topic, a complicated one.
Mhm.
So I think we all know a lot of our sexual activity in contemporary culture is heavily scripted. It's
Yes.
inherited
Absolutely.
from examples, where we're taught how to have sex, and it's straight sex, it's monogamous sex, it's cisgender sex, it's sex centered around the man's pleasure, and it's also neurotypical sex.
Mhm.
And there's a very small number of activities that count as sex. Which ones do kind of depends on a whole bunch of factors, political, social,
Yeah.
etc. Like, I did not have sex with that woman, like
It's really it's very intercourse based
Yeah.
is
absolutely,
yeah.
absolutely. And it's also, sex involves a lot of communication, ideally verbal, but also largely nonverbal.
Yeah.
Um, and it involves a lot of sensory experience.
No.
A lot of it, a lot of touch, a lot of smell, a lot of taste, There's a tons of different sensory aspects, and all of it is centered around the quote unquote neurotypical experience, you
Mhm.
know? So there might be, someone who's autistic might be a little more touch averse because, the feeling of another person touching them just on a tactile level can be, aversive. But they might internalize, oh, that makes me sort of a bad partner. That makes
Mhm.
me someone who like can't show up sexually. I can't satisfy my partner. But no, like, we can break apart that myth. Sex doesn't require skin on skin contact, you can stay clothed, you can get a latex doll suit, you can like all this stuff, and I think once you start just like with queer sex, once you start breaking away from prescriptively neurotypical sex, it can get so much more fun because you can start to get more creative and also really get the opportunity to think about what you actually want. Like some autistic folks, kissing is difficult because it's mouths, it's wet, it's closeness in a way that's uncomfortable. So maybe you work out with your partner some alternative to kissing that like plays the kissing role, if you will, but
Mhm.
is an activity that works for the two of you. And I think this is why a lot of autistic folk gravitate toward kink and BDSM. For me, in my personal experience, flogging is stimming. And stimming is that repetitive grounding behavior that helps us kind of soothe the nervous system. And whether I'm topping or bottoming with floggers, it's it feels like stimming, Wax play, electroplay, these are very sensory based things that can really open up whole new worlds of intimate and erotic connection. Are they sex or not? Well, we could argue about that all day. I'm not sure it's worth arguing about. Can they play the role that sex plays for people? I think so. Yeah.
That's such an interesting point about flogging being stimming. I had never thought of it that way, but that is so like blowing my mind right now because a lot of people, not just autistic people, but I think people in general can feel a lot of anxiety around like entering that space.
Yeah.
And so if you have an activity you're doing that is like sexy, erotic, and it also kind of plays a role of stemming, then you're giving yourself a chance to enjoy the experience more.
Yeah, absolutely. And in terms of those sort of, accessibility factors, another thing that's really normalized in kink by necessity, you got to negotiate.
Yeah.
A lot of planning, because like kinky folks are doing some kinky stuff and some of it, comes with pretty high risk profile stuff. So there's a lot of sort of discussion of how things are going to play out, what's on the table, what's off the table, what to do if certain things happen. So if this happens, you call yellow, you call yellow to signal this, or you call red to signal this. And you get that assured, like, I know that you know that I know this script that we just co-constructed together, and it creates boundaries that you can then play in, rather than just the sort of more vanilla experience, the typical vanilla experience, where you're both kind of fumbling around with this socially inherited script that you might have very different understandings about, and it's considered completely unsexy to acknowledge any of that.
Yeah.
In ca Like, you really get to talk through it and make sure that people are on the same page, and that can create so much more of, like, an accessible environment for autistic folks. To spin off of that, autistic folks are also more susceptible to trauma, right? Like, autistic folks, just being autistic in the world, being a marginalized person can be traumatic. And I would say, like, negotiating is a not is always, but it lends itself toward a trauma-informed sexual practice. It's like I teach yoga, and I'm trauma-informed certified in yoga. And one of the things we do is we say, okay, this is how the class is gonna go. We're gonna do this, and then we're gonna do this, and we're gonna do that, and we're gonna wrap up this way. And that way people are going into it not unsure of what's gonna happen. They feel a little more safe. They have this roadmap, right?
Mhm.
Same thing with negotiating a scene in BDSM. It can really help us feel safe because then we're knowing what to expect. And if we're autistic, if we've accrued trauma, that can really help us like relax into it, ease our nervous system so that we can actually enjoy ourselves.
Man, that's okay. So I'm gonna ask an ignorant lesbian question here, just because I'm curious. So when we're talking about the kink community, which I love, that's definitely something that you discover usually when you're an adult. Something that takes a little bit of a time to get there. But there's a lot of people who are having sex around 18, 19, 20, who haven't discovered this beautiful community, right? So I'm wondering, does the autistic community have issues with consent? Like, especially in the holistic world, because I could see that being, like, a problem. We were talking about trauma, so I can see that definitely being a problem if you're not reading the cues that like, masking. Like, I could see consent being an issue with masking for sure. Would you find that true?
Not an ignorant question, by the way. Yeah, I was gonna say, no, that's actually a really good question.
Yeah. So I'm not familiar with any like published research on this, but to kind of like speculate a little. So I mean, problems with consent are widespread.
Yeah.
Um, I think pretty much if you're raised in contemporary American culture, you have internalized a deeply problematic notion of consent. And a lot of consent education is deconstruction of the notion we've inherited, which is hard work. And it can be hard for autistic folks because like I feel like I've said that so many times. That's like my mantra here. It's hard. But
Oh.
with consent cues, right, are oftentimes nonverbal,
Yeah.
right? We might try to convey consent with a glance, or we might try to convey consent with a squeeze of the hand. An autistic person might not interpret it that way, right? So there might be signs where they're missing consent, right? Which is something that my friends tell me happens to me all the time. Um, yeah. um, but then there's also consent. Like, I think there's a feeling that we feel inside when we are consenting to something. There's a way of like checking in, listening to yourself, learning what a yes feels like in your body.
Mm.
That can be really hard sometimes for some autistic people to identify because one aspect of neurodivergence that some autistic people experience is this real difficulty in identifying their internal states or their somatic states, right? So like telling when they're hungry, telling when they're thirsty, even identifying that this emotion is anger rather than something else, right? So there's that difficulty in self-understanding, and I think that can lend to a difficulty in understanding when consent is enthusiastic, when consent is like genuinely present in the body, right? Yeah.
Mm-hmm. The like speaking of consent, and I'll give kind of my work experience too. Um, Definitely a good point. If they have difficulty with like identifying their internal experience, like what I'm actually feeling, that can make it difficult. And then I think it's natural to go to this standard script that we all learn. And so you're like, I can't really identify, but like this will be okay. And then where the trauma can come in is you might be like in the middle of something and realize, no, this actually isn't what I wanted to do. And then how do I say no to that? And I think that's why like the negotiation ahead of time, like is very important. I also think too, and this isn't true just for autistic people, I think it's true for anyone. Um, if there's a lot of trust with the other person, I think it's easier to rely on a feeling versus if it's someone I've not been with before. We might need to be a little bit more explicit about like what we're agreeing to. Um, and last thing I'll say about consent is that I think one of the most difficult things about my work is that sometimes there will be partners that they're not super great about consent, or they get really frustrated if they're not getting what they want.
Yeah.
It's kind of like, well, I have my script and that's really all I want to do. And so I'm hoping that you as the autistic person will just want to do what I want to do. And they don't really have the negotiation skills either. So then it's so hard because then you're trying to work with both of them on, hey, there is a way to meet in the middle here. But I think you have to be open-minded. I think you have to be patient. I think you have to be understanding. And unfortunately, not all partners are like that for a long time. And then we go back to almost that being a traumatic experience. Like imagine you're with this person, you might really love them, you want to be with them, but what you're hearing from them is, I'm not offering enough for you.
Yeah.
And so it's really, well, going back to you repeating, like, this is so hard. It is so hard,
Yeah.
right?
Yeah. I think culture at large can learn a lot from like queer people by really learning about the richness of queerness. Even straight people
Mhm.
and cis people can learn a lot about themselves, right? Because by looking at queerness, we deconstruct norms. And then even if we're following those norms, then we can start to realize whether we're doing it authentically or whether we're following them because they're the norms. I think the same thing with monogamy and non-monogamy. I think monogamous folks can learn so much by studying non-monogamy, right?
Mhm.
And to loop it back to our topic, I think neurotypical and allistic folks can learn so much by learning more about autistic folks because by really taking seriously the experiences and the testimony and the perspectives of autistic persons, we learn a lot about our like physical engagement with the world, about our social communication, about the way brains work, about sort of attention, about all sorts of things, in a way that really shows much more of what is possible in the realm of being human, period. Right. So I really think by like listening to autistic folks, we could have so much better consent education. We could have so much better sexual education, so much better dating experiences, so much better everything, not to get too, hyperbolic about it. But if we just listened to these folks rather than pretending that the world fits this very, very narrow little sliver of what it actually is. Yeah.
So, speak to those people. So speak to your neurotypical partners that you've experienced in the past, or maybe your future neurotypical partners. Where do they start? Like, if they want to date you and they want to learn more, what resources would you give them?
Yeah. So I would say if someone says they're autistic, trust them
Okay.
and listen to them. Like, that's a great place to start because your best resources are going to be the people in your community, and the people you can actually interact with and talk with, right? After that, there are a couple of folks that I would recommend checking out. One I mentioned earlier, Nick Walker, with her collection of essays, Neuroqueer Heresies. It's a really kind of accessible, just kind of tour through so many of these concepts in language that like straddles the clinical and the non-clinical. And then another thinker who I'm very, very fond of is this psychologist, author, advocate, Devin Price. Devin's got a couple of books. I got them all right here, so I'm just reading them off my shelf. Laziness Does Not Exist, which I think is a really important book. Like, if you're going through autistic meltdown and you're struggling with persistent desire for autonomy, or what some people call pathological demand resistance, where like you can't even brush your teeth, much less apply for a job, that doesn't mean you're lazy. It means you're experiencing something and you probably need support, right? And then also Unmasking Autism is Devin's second book, the new one on unlearning shame, and then another one coming soon on Masking for Life. I think that might be the title. Devin's work is incredible. They are a very political presence on social media, which might put up some barriers for some folks, but their work on this material, I think, is absolutely fantastic and also informs their politics. So, yeah, I would definitely recommend Devin Price as a resource for folks.
I love that.
I love their work too. I've recommended many of their books, especially for like the neurotypical partner, right?
Yeah.
If you wanted to get an understanding, I think, yeah, great resource.
I love
Yeah.
that as a starting point. That's really good. And then just to summarize for our audience, just to summarize something that you said earlier. So if you are a partner and you're dating someone who is autistic, I guess the clashes would be something that you suggest that you guys talk through. So example, I've dated someone who didn't like to be touched at all. Like just certain, like I couldn't like obviously I could grab her, but I couldn't like graze my finger because it would mess her with her sensory issues. That was something that I felt was really like it really almost a little bit defeating that I couldn't make her feel good in that way. So, but it was, I mean, I respected her boundaries, but it did feel like it was something that was missing. So you would suggest in that situation that we kind of talk and try to find something that works for both of us, like a middle ground in a sense, but that would require a lot of communication.
A
Yeah.
lot of communication, maybe some leaning into experimentation.
Okay.
Probably gonna be some trial or error. And you wanna make sure all parties involved are okay with the possibility of error. Like, you might try something that someone really doesn't like, you know? Um, but I think, yeah, like if you're in like a committed relationship with someone and like your goal is to keep the relationship and you want to customize your intimacy and your sexual encounters, like exactly what you just described is the way to do it. On the other hand, I think one way of opening up this notion of sex and like thinking about, sex could just be sitting and staring in each other's eyes for an hour. Sex could be like playing patty cake. Sex could be electrocuting each other, or taking turns. It could be all sorts of different stuff. By exploring that and being open to that landscape, we can really start to learn what our own actual preferences and needs are rather than what we feel like they should be. And then we might just find out like someone's just not the sex partner for us.
Oh.
It might be like, hey, if touch is really important to me and touch is aversive to you, maybe we can explore some other kind of relationship, maybe some other variety of intimacy, but we might not be a good fit for sex partners. And the thing is, then that isn't a failure because it's not like one of us isn't living up to this shared script that we're both expected to adhere to. It's just kind of like we went to a buffet and we picked up different stuff and we looked at our plates and we're like, oh, we like totally different foods.
Yeah.
That's totally okay.
Okay.
Yeah, I'll give you an example of like sometimes when we're negotiating, we're trying to meet in the middle and we're trying to like accommodate in a way. Like if a certain touch is just really uncomfortable, being touched with when your partner's like wearing a glove might feel much better than being touched with the bare hand. And so sometimes you're also exploring like, is there some kind of like material that is comfortable to me, that can be our go-to thing whenever we're open to touch, right? Like there's little thing, and again, it won't work for everyone, but I'm just sharing that one example because I think it's very easy for people to get, and Denise, I'm not saying this was your experience, but like it's easy to get discouraged, like, oh, they don't want me to touch them. And I'm like,
Mhm.
well, let's see
Yeah,
if we don't have to stop there. Maybe there's like other things you can try.
absolutely, absolutely. There's this meme about like the two kinds of autistic people, the socks on all the time and the socks on never autistic
Yeah.
people. And that it has to do with, like, the feeling of the material and the feeling of the foot, like, on the floor. It's a very much a sensory thing, it can be a temperature thing. Certain socks might be unbearable, and I think you can apply that pretty straightforwardly to sexual context, you know? It might not be that all socks are bad, it might be that you just need to find a different cut or a different material or something like that, and then you'll be able to wear them. Or maybe you find out after some experimenting, you're like, "No, I'm a no socks person," and that's fine.
Okay. Do
Mhm.
you have any advice for someone who is autistic to like how would they what's a good way for them to communicate their needs and their boundaries? Like is there a certain, I don't know, instruction?
Yeah, so I just did a webinar for Plura, which is like a gender, sexuality, relationship diversity app and social networking platform on it was called Finding Your Voice, Active Agency in Boundaries, Consent, and Decision Making, and talked a lot about this sort of stuff there. First thing is trust yourself. And I think sometimes people have a really hard time, especially marginalized folks, including autistic folks, have a hard time advocating for our boundaries because we internalize this version of imposter syndrome that isn't tied to our competence, but is tied to our worth. We feel like we're not worthy enough to advocate for our own boundaries. And then over time, we lose our voice, right? And that can be a really hard space to be in and to get out of, right? But here, and I'm going to slap myself on the wrist for what I'm about to say, but also going to stand by it. Um, so I also do a lot of work. I help administer a dialectical behavior therapy program. And DBT has a lot of interpersonal effectiveness skills, right? They're almost like little checklists that you can follow when you're wanting to have a difficult conversation or when you're wanting to really express a need or a boundary and you want to get in there effectively, strategically, and like really um, maximize your chances of getting that need met or that boundary acknowledged. Now it's complicated because the use of DBT with autistic folks can start to feel like prescribed masking, right? Like in one of the skills, one of the steps is appear confident. And that's such a neurotypical notion, right? But there's ways of doing this like in a sort of autism affirming and neuro inclusive manner, which is what we do in this program. That all said, there are some DBT skills like the Dear Man skill, right? So it's an acronym. You describe some facts, you describe the facts relevant to the situation, you express how you feel about them, you assert what your need is in light of those, and then you reinforce to your partner that you're talking to, like what the benefits of having that need might be, right? And you remember the man part is you remember to do this mindfully, right? So you're not doing it while you're driving, you're not doing it while you're multitasking, you're not doing it while you're driving down the road, you appear confident. And the way I like to rephrase that is you don't make yourself small. You allow yourself
Mm,
into that space. And you remember to negotiate. That's the N, right? And what you do there is you have it be not an ultimatum. You're not strong arming your partner. You're not telling them how it is, but you remain sort of open to their thoughts and input. And what that does is that's almost like helping you pre-plan, pre-script, almost negotiate with yourself how the conversation can go. It gives you an order of operations that can make this sort of speaking up for your needs, for your wants, a lot easier to do. Um, So yeah, that's like kind of a long, like quasi-clinical, also not kind of clinical answer, but yeah, did that make sense?
No, I love that. For someone who's
Yeah.
very analytical, dear man, it'll stick with me. That was
Cool.
great.
Well, and a lot of autistic people like having some sort of breakdown, instruction, like a framework, right?
Yeah,
I
Framework,
think it
yes.
helps a lot.
absolutely. And I think like, as someone who does DBT with autistic folks, I think what's really key is autistic folks struggle with rules and they also love rules. Not to speak of all autistic folks, but like the thing is, the rules need to make sense and they need to be opted into. Top down imposition of rules and structures, very difficult. But if you're like co creating a structure with someone, if you're like negotiating what your agreements are going to be, that can become a lot more accessible because like that structure helps us move, but if that structure is like forced on us, especially if we don't understand it, we're just gonna ignore it. Or it's gonna trigger a lot of stress and anxiety, right? So working with like a dear man, customizing it, not doing it because it's the DBT thing to do, but doing it because it makes sense. And if you need to swap out the A for something else, then do that. Have agency. But creating that structure for yourself, really, really powerful.
Wow.
That is something I experience. I don't have autism, but I have ADHD, and the rule needing to make sense. I mean, this is probably why I have to work for myself, because I feel like every job I've ever had, there's always like some rule that comes down from the top, and I'm like, this makes no sense. This isn't going to work. I'm not going to do it. And it's not even that I'll like actively be like, I'm not doing it. It's just it's almost like when you skim read an email and you're like, dumb, and you like put it to the side and you just like never address it again. And then, 2 months later, they're like, Lindsay, why haven't you done the blah, 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 blah? And I'm like, I don't know why I need to do that.
Perfect. All right. So I'm going to give you my spiel that I give all my guests. Basically, that this is a very sex positive podcast. And one thing that I learned about the sex positive movement, actually, three things I learned about the sex positive movement were that A, consent is number one. You need consent for everything you do. Two, sex positive movement is very inclusive, right? Different body types, genders, cultures, neurodiversity, like we include everybody. And then third, learning about how we are preaching education. Like education needs to be comprehensive, needs to be inclusive, and it needs to be at every stage of your life, right? So I'm curious about your education. So I want to know both at home and your formal sex education that you received whenever you were younger, whether it was in a class, but I also want to know at home, like, did they have the talk with you? How old were you? So go ahead.
Ah, when I was younger. Yeah, no. I mean, we learned names of body parts, some incorrectly labeled. I learned how to avoid pregnancy. I learned some suggestions for how to potentially avoid pregnancy. I learned some suggestions for how to avoid transmission of STIs.
Yep.
I think that was it for sex education. And in my household, when I was growing up, we didn't talk about it. I had one conversation with sex about my mother once. Based on that experience, I would never do it again. I am a very open book. I am someone who will talk openly about sex to anyone in any context if they're on board with it. Not at home. um, yeah, because I could feel how awkward it made them feel.
Yeah.
And I was like, "Yep, no, this is not the vibe." So for me, my sex education, it came later in life and it came a lot through trial and error, came a lot through self-exploration. I'm a trans person who is asexual and also identifies as lesbian. And I'm also of the opinion that I've been that way my whole life, even before I use those words. So all of my old cis het relationships that I was in was a straight girl dating someone who didn't yet know that they were a trans lesbian asexual, right? So I look back now and I'm like, oh, well, this is why that didn't work. um,
Mhm.
we were not at all aligned. So a lot of learning through trial and error. And then most of my sex education after that came, I've been an academic for a long time. I've been teaching college since 2008, got my PhD in 2012. So I'm a research nerd. So just when I get into a topic, I do a deep dive and I like do a literature review. I like books. So I've got hundreds of them behind me, like more like I don't even know how many. And then, I got my training through the Sexual Health Alliance, where went through that, got certified as a sexuality counselor, and learned a lot there. And then went back and revised their curriculum for them, and did a bunch of education for them. And now I had been teaching the Kink Informed certification program with Midori, who's an amazing educator, and learned a lot from collaborating with her. So it's like I have so much to learn. Um, so much to learn with my nose in books, and so much to learn with like myself in a dungeon, like getting the experiential aspect.
Mhm.
And I'm excited to see what I'm going to go on to learn. But in a sexual context, learning can also be scary because you can learn that you were doing things that maybe weren't the safest.
Yep.
You can learn things that maybe weren't like that you were doing things that weren't necessarily congruent with your values.
Yep.
But I think it takes courage to learn about sexuality, and like that is a really good thing to lean into. Um, because if you're doing things that are not congruent with your values, better to be aware of that eventually than to keep doing them. Yeah.
Okay.
Absolutely.
So how old were you whenever the first topic of any type of sex education came up? Were you in middle school? Were you in high school?
I mean, I never had the birds and the bees talk. I would say probably middle school health class taught by my gym teacher who
Yeah,
like
yep.
taught
Oh
about
my
it,
The
you
God.
gym
know?
teacher.
We joke about that. I mean, we're in Texas, so our experience is similar to yours. It's not great. And mine was the softball coach.
Gym
And
coach, yeah.
yeah,
Yeah,
it's,
gym
it's
coach.
always something,
Yeah.
someone who like got thrown in that role. They're like, you have time for one period of this, and then they're like, don't know what to do.
Yeah, yeah.
Uh, and I had this distinct memory in my, I think it was 8th grade biology class, where it was the biology teacher who was also the cross country coach, had this diagram of like anatomy of someone with a penis, and it went from flaccid, and then he could like hit a button and it would like become erect, and then he just kept reversing it and like doing it and like up and down. And we're a bunch of ninth graders sitting there like, this is hilarious, but you shouldn't be doing that, man. Like, what are you doing?
That's good.
To keep doing it, to just keep
Yeah,
repeating that motion is so
Oh,
funny.
hilarious.
a while. He was very satisfied with himself. But like, yeah, that's the sort of sex education I got as a
What
kid.
state was this?
That was in rural Pennsylvania.
Okay. Okay.
Yeah, and that would have been in the like early 90s
Okay.
that I was experiencing that, early to mid 90s. Um, Strangely enough, I'd say a lot of my sex education really came when I was living in Texas. Because it was then that I really started frequenting dungeons and going
Mm.
to classes and opting into community education and serious discussions about consent, accountability, safety, really thinking about these things on a pretty deep level, deep not just out of philosophical interest, but deep out of like necessity. Because if you're living kinkily, you need to be reflective about what you're doing, or else you're gonna get hurt or you're gonna hurt someone. So, a lot of my education came from that lived experience.
Well, kind of like you were saying earlier, it's like neurotypical people could learn from autistic people, or monogamous people could learn from non-monogamous people. It's the same with like vanilla people can learn a lot from kinky. Even if you never are, even if you're like, I'm not a kinky person, I don't want to do bondage or whatever. There's still so much you can learn that you can apply in your vanilla relationship.
Mm,
Absolutely. I think vanilla folks should absolutely all of them take a negotiation class.
agreed.
Yes.
You
Yep.
know? And you know who else should? I do a lot of community organizing. And I think a lot of activists could also learn a lot from kink and BDSM community when it comes to community accountability, conflict resolution, consent, negotiation, all of these topics. Like for folks doing difficult organizing work, like which is, not at all a sexy context. It's anything but the skills that need to be developed from these communities that are marginalized, that can't always speak publicly, so they have to like work through their stuff kind of at a horizontal level. It's kind of like how people need to listen to sex workers more because like
Yeah.
know what's going on because they have to. It's the same thing here.
Yeah,
I
absolutely.
love that. That's good.
This has been so wonderful. And your experience and knowledge and education, I feel like everything we've discussed today has really been rooted in empathy.
Yeah.
Is honestly like the best way that I could sum it up. And yeah, we definitely love to have you back on one day. Did you have something you wanted to say?
Oh,
I was,
okay.
oh, I was just gonna say that would be amazing.
Yes,
Yeah.
good. I would actually, I really would like to have you back on. But since I do have a sex educator in front of me, the last question I have for you is, what advice would you have for parents or sex educators when discussing sex education with autistic teens?
Remember that your teen is autistic.
Okay.
It's okay,
Hmm.
right? It's not better, it's not worse, it's your kid. And better to accept that than to deny it. So let's start with that. And then also remember that your kid is human, and humans, and I say this even as an asexual person, we are sexual creatures,
Mhm.
right? Sexual exploration is natural, it is normal, it is healthy, right? As a parent, you might feel awkward. You can work through that. And your awkward feeling about it is not your child's problem. And you want to make sure that your awkward feeling about it doesn't create hurdles for your child to develop into like the sexual being that would most suit them to be. It's pretty broad, but that would be my suggestion. Remember that your kid is autistic and remember that your kid is human.
I love it.
Yes, perfect.
Yeah.
Well, we want to, before we wrap up, I want to give you a moment to promote yourself for all of our listeners. We'll have links of how to find Lee, social media, any works that they have, but we'll give you a minute to promote yourself and tell our listeners where to find you.
Yeah, absolutely. So I at my website, transcendentcoaching.com. I also got my Instagram. I've got a Patreon. So stuff that you can find there on the Patreon. I do weekly office hours. I do weekly mindfulness groups. I do co-working spaces for folks who want to body double, even virtually. And I also make a lot of zines on different educational topics. So I have one up there on deconstructing neurotypicality. I have one on deconstructing internalized capitalism, all sorts of different stuff there. So you can check that out. There's also webinars. I did one with Midori recently, Queer Kinky Punk Zine workshop series that you can stream on the Patreon. I'm also available for coaching. I do kink informed, queer centered, non monogamy informed, sex worker positive coaching and consulting. Um, I'm available for consulting with other folks who want to check in on any issues related to gender, sexuality, relationship diversity, and neuro inclusive frameworks. And I've been doing a lot of webinars with Plura, again, the app that I mentioned earlier. So I'll have one coming up, I think in November of 2024. If you're, listening to this before that, on applying principles of transformative justice to conflict resolution in intimate relationships. And then I'm doing a series with Plume, a virtual gender affirming care clinic, which really, really does amazing work. I'm a huge fan. Um, got coming up later in October a webinar totally free on neurodiversity and the trans experience. And then we're going to be we do one like every month. So folks just like check out my stuff. They can keep in the loop about each monthly topic. So lots of cool stuff coming up. And folks can always, if they want to reach out or they want to connect in any way or collaborate, can always just reach out over Instagram or email.
Amazing. Wow.
Awesome. Yeah. And like I said, to our listeners, we'll have a link for everything that you just mentioned.
Yeah.
So we'll also have links for the resources you mentioned, like the books that you mentioned. We'll have links for those as well. And last thing I'll say before we wrap up, to anyone that does tune in regularly, we are open for listener support. And so if you would like to support us, you can do so for as little as $1 a month. And we'll have a link for that in our page description, and we'll let you know how to find that. But yeah, thank you so much again for being on. This was wonderful. And for anyone who is listening, let us know what you think and what you want to learn more about. And we are always open to listener suggestions of what our topic should be. So again, thanks for tuning in. We are Sex Positivity Unfiltered. And remember to stay curious and fuck politeness.